Hello. Hello.
Hello, madam. Hello.
Good evening.
Good evening, madam.
Yes.
Madam, is it okay? Shall we wait for another 5 minutes? Is
It's
it okay?
okay.
Right. Okay, madam. We'll put a message to the others.
Uh, Hello? Hello?
Madam, we can
Yeah.
start now,
Can we
madam.
start? Yes.
Yes, madam.
I actually, went through the questions and I just jotted down what I thought and what should be included in a PowerPoint presentation. Is it okay if I share that with you all? So it will be easy to discuss the questions.
Sure, madam.
Or
Right,
is
okay.
there
I gave
another
the
way you want to do it? How?
no, madam. That's fine, madam. I gave the screen share option also to you, madam.
Okay, thanks.
Alright.
Okay. Um, right. Okay. Good evening, everyone. Nice to be with you all. Can you see the screen?
Yes, madam.
Yes, madam.
But I can't. I want to see the chat. Mm. Okay. Do you have any preferences regarding the first order? I thought of starting with the AEFI.
Yeah, madam. It's better, madam. We'll start from EFI, and there's a special small question also to madam to be discussed with you also. It's in the chat box, madam.
I saw it. Yes,
Yes.
we will discuss it later.
All right. Okay.
Right. So hope you all can see the screen.
Yes, ma'am.
Okay.
Yes, ma'am.
I can't see the. Just give me some minutes. Okay. So we'll start off with the second one. The 2016, the HPV vaccine, and it has some like 50 marks for the introduction of a new vaccine and 25 marks each for AEFI. So shall we discuss that first?
Yes, sure, madam. Yeah,
Okay.
it's okay.
So have you all done this lecture, first of all, regarding vaccines, immunization?
Yes, ma'am.
Yes, madam.
You all have done it, no? So you will have a basic idea. And what we have to remember is when you are writing the answers in a question paper in either MSc or MD, you should actually organize your answer. It is very easy because there are, in community medicine, there are some phrases and sentences that are their key sentences that you all can, juggle around to include in any answer. So don't forget, those things should be there. So when you write the answer, if you have only, I can't remember how many hours, and one question,
30
let's say
minutes
50
per,
marks,
madam. 30 minutes per question, madam.
30 minutes per question. So 50 marks will be right 15 minutes.
Yes, because what we are doing, madam, we'll take 5 minutes to read the question and jot down anything, and taking 25 minutes to write the 100
Right, yes.
marks
So
answer.
so let's say 25 minutes. So within 25 minutes, your answer should encompass all of that. So you have to write those things. And as I said, it is mostly common to many. So we'll start off with this first question. Ministry of Health has decided to introduce human HPV vaccine into the National Immunization Program from 2017 as a cervical cancer preventive vaccine. Describe key factors to be considered in introducing HPV vaccine into the National Immunization Program. Can you all tell me what do you think? What you should write? Somebody can you just come out so we'll see what we can improve or to add on that. So these 50 marks, what would you write? First sentence. What do you think?
We had talked about the first disease burden of the cervical cancer, madam.
Yes. So just jot down what it is. So that means you have to now see, you have to have an understanding of the common things that people are talking now in 2016. There would have been the introduction of the HPV would have happened, if I remember correctly. It started in 2016 or 15, around that time. So that is a hot topic. So always keep tabs on the hot topics at the moment. So one question will come from a hot topic. So you need to know, like it could be HPV, now it could be COVID. So you have to know, most probably a question will come from COVID. So you have to know COVID. What is COVID? A virus causing a pandemic or something like that. You have to have a sort of a sentence regarding that. So I think it is okay. Then what? Then, as somebody said, we have to talk about the disease. Again, like define the disease, talk about the mortality, and then, sorry, mortality, morbidity with the data. I think I have juggled this thing a bit, but you have to talk about all that. What would you write for this 50? I'm just going through like that because I need to understand how you think also. In the first part, definition of the disease, what would you write? Disease morbidity, ඒක ගැන මොනවද කියන්න පුළුවන්? Do you know anything about the HPV infection and the cancer and the data? එහෙම data මතකද?
Cervical cancer is the #1 killer of cancer.
Sorry?
Cervical cancer is the #1 leading cause of cancers in females.
Yes. So now that is a very important aspect. So those things should be written. It could be breast cancer. So then you have to write the second most important this thing, something like that. So this is like common. If you think now COVID, and if they introduce the COVID vaccination to the EPI, likewise, so you need to write at least 2 or 3 sentences. And then annually, like if you know the death rate, then you can write, right? And what else? The burden of the disease, morbidity, mortality with data, cost of treatment and management. This is important, no? So annually, the health system has to spend a huge amount of money on treatment. So this is also an issue. And HPV is like those days in 2016, they would have definitely known about this situation, and they would have taught this. So then they will say there are 4 sub he had the 17 or 18 serotypes, and the vaccine will be preventing 4 serotype name, if I can remember.
16 and 18.
4 or 16 or no maneda.
16 and 18.
16, 18.
Not 2.
16 and 18.
Just 2? No.
There are 6 and 11 as well as 16 and 18.
Yes.
Vaccine is for 16 and 18. I thought like that.
No, there are, I think, 4 serotypes. I don't know the new. I remember the new. I will check and let you know. So for likewise, you have to write that. If you don't know, don't write. But you can generally say there are several serotypes, and vaccination will protect you from 3 or 4 serotypes. Okay, cancer causing serotypes. And the cost effectiveness. So if you prevent through vaccination, you will prevent deaths, mortality, morbidity, everything. So just some like 5 sentences would be okay, more than enough. Then what? Then what can you say? Then
This vaccine has to be targeted.
yes, actually you have to describe the vaccine type, dose, route, below the burden of disease. Okay, just put it below this thing, and you describe the vaccine in just 1 sentence. It is a subcutaneous 0.5 milliliters, something like that. So you just describe that, and then we have to think of all those. So likewise, the target group, where are we giving, and the cold chain, whether we have adequate, the other resources, whether we have enough, what are the resources that we need?
Human resources for storage facilities, we need the resources.
So resources, what? What is the other one?
And money,
Yes.
material.
Money, man, material, and
machine.
time. T. ඕගොල්ලන්ට ඕවා ඉගෙනුවේ නැද්ද? Because actually when we were doing the MSc, මම ඒකයි කිව්වේ ඔය වචන ටික ඕන එකකට දාන්න පුළුවන්. You can use in any this thing. Resources. So you write M, money, funding. එතකොට අමතක වෙන්නේ. Right? So remember MMMT. So when you say mama me mehima nikam වාක්‍යයක් ලිව්වට it is not just a sentence. So when you say resources, you can expand on this, right? Just write MMT and manpower, whether adequate, whether we have enough PHIs or PHMs to carry out this thing. So why do you write like that? Resources, PHI, because this is supposed to be in the MOH office. So you know in the MOH office who will be carrying out the vaccination. So then the person who is reading the answer knows that you all have think according to that. You are thinking actually what is happening in the field. So when you say resources, you have to write manpower, material. So what are the materials needed?
Call boxes, ice line refrigerator.
Yes. So all those things you can just write. So at least one or two when you say material. M ඊළඟ M එක මොකක්ද? Money, funding, right? So we need to think of all that before introducing a new vaccine. එතකොට අර මං කිව්වාගේ time. So what is the time in this instance?
Target category, age group.
Hello?
The age group we are giving the vaccine.
Yes. The target group. And when are we giving it? So whether we can incorporate into the normal system, whether we could give it in the clinic, HPV, or in the school setting. So the time is very important because we don't want to actually burden the people and have an extra visit to the clinic or the school to get another vaccine. So this is important. So when you say time, you can write that. So you can expand your expand your answer within that. So when you say feasibility, you always write like that, right? Remember MMMT okay කොහේ හැම ප්‍රශ්නෙදිම okay එනවා, right? So you have to write accordingly. Target group. So we have to think of the target group. Any other thing that you can think of? Any new thing?
Global recommendation.
Sorry?
Global recommendation, madam. Whether there is elimination target we have to achieve.
Yes. Good. Actually, what is, so here you can actually define, when you define the disease, you can talk about it. So whether you need to eliminate, whether you need to eradicate or just control. So you can, of course, include it in the upper part and the availability. So all these words are like the ones that are usually used in our public health field. So you have to write accordingly. What do you mean by availability?
Availability of safe and efficacious vaccine.
Yes, safe and efficient vaccine, and whether they can provide it. It also a part of sustainability as well. So the vaccine availability, whether we can get it, whether it is WHO recommended. I hope you all are writing down those things because I did not have time to write those things. WHO recommendations in Nevage, you have to write, right? So, you know, with the COVID situation, there was a huge controversy regarding the WHO qualification. So, this is what the vaccine introduction is like. So, back in, I don't know, long time back, there was a problem. Those days there were no recommendations to take only the WHO recommended vaccines. There was a quality issue and deaths, and I don't know, I can't remember. So the Sri Lankan government has taken a policy decision to get only WHO qualified vaccines for our EPI program. So when you say availability, you always like, you know, highlight the WHO recommendations. Okay. What else? And also cost effective. When you say availability, WHO recommended. Hello. Hello. Hello.
Yes, madam. Can hear, madam. There is a connection with that person's line, madam.
There is a.
No, madam. Not yours, madam.
Right. Somebody's right. So somebody wanted to ask a question.
Maybe, madam. He will ask.
Okay, right. Also availability, and there should be some other things as well. Sustainability. So because you can't introduce a vaccine and then stop halfway saying that you don't have any funding or anything. So what is our funding? Like, there are those days either the Gavi or WHO, UNICEF, they may support. So you saw in the first instances during the COVID situation that people gave us, they donated vaccines. Then our government stepped in and continued. There is a commitment. The political commitment is there because our financial authorities, our parliament. So we need the political commitment from the leaders. Otherwise, it is like halfway through, if they say we can't fund, we don't now at the moment with the current economic crisis, if they say we can't give the money, it's a problem. But actually our public health people are very far-sighted. So they have already ordered, and up to September, we have the childhood vaccines, I think, up to September. So unlike other people who don't, you know, predict, this is the beauty of public health. So you know what is happening and you prepare for that, and the sustainability should be there. So it is always advisable to, not always advisable, you should advocate the political leadership and get a financial commitment plus the administrative leadership as well. So those are the things actually that we need to think when we are introducing a new vaccine to the our system. Okay. So this is common to any vaccine. Okay. You just need to juggle the upper part a bit. Any questions? Do you want any other things? And maybe I have forgotten some of the other factors. If you want to answer any question, sorry, ask any question. Okay. Are you okay? Do you think that you can write? Like now you practice whether, so you write all these. First of all, you write just the words, right? Feasibility, availability, sustainability, like that. And then you fill the gaps. And when you write 2 or 3 times, you remember. So when a question comes, you can just quickly write. But as I said, you need to write according to the fact that you are thinking like a mid-level manager or a national level manager. So as I said, you should know about the cold chain, you should know about the cold chain equipment and the resources that needs to be there. So when you write the answer, the person has to know that you are writing at least knowing some background of the situation and the target group and the setting. So all of that can be expanded, and the availability. So shall we move on, or do you think?
Yes, madam, we'll move on to the next part,
We'll
madam.
move on. And the AEFI. And AEFI, so you know the reporting system of the AEFI. Somebody did the AEFI with you?
Yes, madam.
Yeah. So usually this is the flow chart. So you don't actually, if you can draw the flow chart quickly, then that's good, but 25 minutes. So the describing the reporting system of AEFI in the country. So this is basically it, but you need to put the form 1, form 2 like that wise. So we start with the immunization clinic, and when the child gets the immunization, what happens? If he's okay, if he or she is okay, fine. But if he or she develops sort of any AEFI, what happens? Usually either the mother goes to the hospital pediatrician or the GP or inform the PHN. So there are 2 or 3 ways that we can get the data. So when the PHM is informed, then she actually records it in the CHDR later, but before that, she records it in the clinic AEFI register. And sometimes the mother comes to the next immunization and we have to ask whether the child got any AFI, and if the mother said yes, she got an abscess, I went to the doctor, got it, and if she did not report it earlier, then you have to include in the AEFI register. And in the hospital also, in the pediatric wards usually, they have the AEFI register, and if a child gets admitted with an AEFI, it is recorded in the register, and the AEFI notification form, it is called the form 1, is sent to the MOH, right? And and also the RDHS office, the RE. In triplicate, we have there are 3 forms. So AEFI form 1 is sent to epidemiology unit, RE, RDHS office, to the RE and to the MOH. At the MOH level, they consolidate whatever the notification forms they received from the clinic AEFI register, also they get the data and incorporate that into the MOH office AEFI register. And monthly, they take those data and send it to the RDHS office. And the RDHS office sends the data to the epidemiology unit. And at the epidemiology unit, what happens, that is called the Form 2, right? Form 2, they have the National Expert Committee, and they evaluate the serious side effects and take decisions, certain decisions. And there is a feedback also. So this, it is easy to draw as a flow chart. I hope that is true even now. Were you instructed to do so? If there's a question like this, 25 25 marks. What do you think? It is easy to draw a flow chart, I think. I hope it is okay. Any questions? So shall we talk about the COVID AEFI system
Okay,
now
madam.
itself?
Yes,
Yes,
madam.
sir.
Yes. So actually, when the COVID vaccination started, epidemiology unit actually, because we have a system in place, we have a system for AEFI, but it is actually childhood, but we have a system. So they thought that in the usual manner, people will report, but this is adult vaccination. So most of the time people don't go to the hospital, and even if they go to the hospital, they will be admitted to medical wards where we don't have the AEFI register or the AEFI forms. So they actually, the EPID unit prepared a separate form for COVID-19 vaccination AEFI reporting. You all have seen that? Anybody saw it? So the treating physician has to send the form. So it is available in the web. If I will try and find it and send it to you. So it is a sort of a very elaborate thing, but there is a system. But unfortunately, we are not keeping the MOH in that loop. So it is like sent straight to the epidemiology unit. But there is this, so at the moment, the MOH is not in that loop. Okay. And the next one.
Madam, we are sending to the RD also, the form with the COVID.
No. I actually, I suggested to include it, but I don't think it will happen. I mean, with millions of vaccination being done, no point. So the serious AEFI need to be investigated. We can't go behind each and everything. So I don't think the RE, no, RE is also not informed. Like you can inform, but the form should not be like, is not sent to the RE. So let's talk about the other aspects.
Madam, this same form is filled in the hospital and in the field, and it's the same form that's filled, madam.
For the COVID-19?
Yes.
Yes, yes, yes.
And then that form is sent to where after that, madam? It's sent straight to EPID unit.
EPID unit. But I actually, we were talking about whether we can include the RE or at least the MOH, but I don't know what happened. I think Aarti has shared it with you. Just check, Aarti, whether it is in the last row. They say to send to epidemiology unit.
Yes, madam. Yes.
Yes, not to any other, no?
No, madam.
Yeah, so I remember I was raising that issue, but I mean, it did not materialize. So this is just, it is just through the hospital to the epidemiology unit. But if there's a question, you can write that the MOH or the RE needs to be kept in the loop. Okay. So are you familiar with the AEFIs? What are the types of AEFI? How many types? Hmm?
Five types.
Yeah, 5. You have to just remember those 5 types. I have not included all those in this thing, but there is the vaccine product related reaction. First one. What is that? This is an AEFI caused by the vaccine due to the inherent properties of the vaccine product. So usually anything that is used by the manufacturer to make the vaccine, so that can cause some adverse events. Can you give one example?
Live attenuated polio vaccine, oral polio vaccine.
Oral polio vaccine, yeah.
Yeah, this live attenuated sometimes causing, yeah.
Yeah.
Vaccine associated.
Could be. Or any other adjuvant, something that can cause a reaction. Then vaccine quality defect. So there could be a quality defect, and it can give rise to AEFI. Then there is the immunization error related. So this is actually was called program error those days. Okay. Now they don't call it a program error anymore. They call it the what? Immunization error. Are you aware of that?
No, madam, not regarding that name change.
Sorry.
Not regarding that.
I think my volume control is a problem. I can't.
No, madam, we can hear you clearly.
Yeah, madam.
I can't hear some of you. Anyway, you know about the types of different types of AEFI?
Yes.
Yes, madam.
So just know about those things. So the examples and all. So is an AEFI that is caused by inappropriate vaccine handling. So you know the process of vaccine handling, and you have to take prescribing or administration. In example, can you give an example?
Cold chain breakage.
Oh yeah, any AEFI that you can think of?
Abscess formation.
Abscess formation, yes. So coincidental event. and it is preventable. So that's why they are asking this question. Why? As a MOH, you can't prevent vaccine product related things. You can't prevent quality defect related reactions. You can't prevent coincidental events, and you can't prevent anxiety related events, but you can prevent immunization error related events. So this is why this question is asked. So as a MOH, what are you going to do? Sorry. So again, as I said, there are things that you can juggle. So first of all, just think of a MOH office or a clinic, and this is related to administration of the vaccine or prescription or vaccine handling. So when you think of vaccine handling, you have to think of storage. So as MOH, you have to properly store and transport the vaccine and vaccine other items in relation to vaccine. What are the items? Syringes. So when you write, we have to properly store and maintain the vaccination materials, then you have to specify proper maintenance of cold chain in storage and transport and storage of syringes. Likewise, so in the MOH, what you are doing, you have to write, but you divide the question answer according to those aspects and preparation. So when you take the vaccine, when you prepare it, you have to check all this, whether we are using the correct diluent and whether we are actually discarding the reconstituted vaccines, and if we are substituting with other drugs. So there were AEFIs, you may not have heard, but yes, one child died in a private clinic when a doctor administered in a private hospital in Kadawatha, if I remember, when a child was given the measles or the diluent they have mixed with suxamethonium. So that child died. So you should not store the vaccines or diluents with any other product. So you have to write that and adhere to instructions to shake the vial properly and all that. So when you prepare also, you try to prevent AEFI. And the injection technique, whether you are injecting into the correct site and route. Can you tell me what happens? Correct site. What do you mean the correct site? In a child? Correct site. If you, what is the correct site for the childhood vaccinations? Either the arm or thigh. What if you put inject the vaccine to the buttocks? What happens?
Possibility of sciatic nerve damage.
Yes, so it is really dangerous. And the root, what is the problem? Root if it is a subcutaneous vaccine, we need to give it subcutaneously or intradermally. If you don't do it properly, there may be problems, right? And then within the injection technique, you have to maintain the sterility. So what are you doing to maintain the sterility?
Injection practice.
Sorry?
Injection.
Huh? Yeah, sorry, AD syringes, use of AD syringes. So those days we did not use AD syringes. What happens? There could be infections, there could be reuse, and they will be infected with either AIDS, HIV, or any other thing, hepatitis. So like that wise, so you can write those also, right? Just use AD syringes and no touching and all that. So you have to expand that a bit. And screening for contraindications, because you have to screen for contraindications. So this is regarding the MOH's role, right? So MOH has to ensure those things are done, right? Screening for contraindication. What happens if you don't screen? What happens? So a child comes and get the vaccine and he has a anaphylaxis and the reaction is there. So when you go back to the history, you find that he is allergic to neomycin or whatever, but you have not asked. So some vaccines contain antibiotics, so you have to know all that. So screening for contraindications, it is important because there may be some reasons. So food allergies, some certain food allergies, just for interest sake, you remember the rubella death in 2010? There was the young girl who died because actually she was allergic to milk products, protein milk products. And actually at that time, people were not aware, our health system we were not aware that the milk products and the rubella also, they had like gelatin components. I think some sort of an animal gelatin component. So this child was actually two children died for meat product, the milk products. She could not even eat a toffee, it seems. So at that time we were not aware that this is a contraindication. But when I was this was in 2010, when I was doing the MOH appointment in 2004 or 5, there was one girl who got rubella, just fell down, anaphylaxis. Luckily, the MOH was at that time, we did not have actually no emergency tray at all. He was actually very experienced person, and he actually did all the possible things and took the child to hospital, and she recovered. But at that time, she was around 16 or 16. We did not have actually a very strong system of reporting these AEFIs. So most probably, I heard from other people as well, there were reports actually. But small children, they had this surveillance system and we knew what is happening. But at that time, the school AEFI. Even now, the school AEFI system is not that strong because we don't have a follow-up mechanism also. So usually the PHM follows the small children, but the big children, they are not following up. So if the child gets admitted only, we know. So this happened. So it is very important to screen for contraindications. Plus, you need to train and supervise your staff to detect and actually treat, even because at the moment, people like we are treating at that site if there are like serious side effects. We have oxygen, we have adrenaline, whatnot, and those days there was nothing before 2010. So this reporting system gave this all, and reporting of AEFI. So the MOH is the responsible person to report the AEFI. So as I said, if in 2004 we reported that anaphylaxis issue, and if there were 4 or 5 cases like that reported, epidemiology would have taken that up and found out that there is a problem. But unfortunately, this did not happen. But now people are more aware and the technology is more, and so it is happening. And again, there was this introduction. I'm very sorry, I'm dragging on, but this is important. Pentavalent introduction. Introduced the new vaccine pentavalent 2008. Within the first 2 months, 4 children died. But the deaths were reported. There were other AEFIs as well to find out what was it. So HE, hypotonic, hypotonic, hypoactive episodes. So those were never reported. We have never heard of it even. But deaths happened, and they stopped the program and did the investigations to see that it is a known side effect of AEFI of Penta. But it has never happened in our country because we have not introduced Penta. So the HHE, it is reversible, treatable if you have other oxygen and stuff. So the reporting gave rise to all that. So those were the things that we learned, and the system improved because of those like reporting system, the surveillance system we had. And again, the serious AEFI, the MOH has to investigate. Do you know what are the mild and the serious AEFIs? Like common or minor AEFI and serious AEFI, there are stuff like that. Can't talk about it all. So those are the things that a MOH should do. Any other issue? There is a actually, so you see, even the 2015 question, you can actually see that this is what we are talking about, no? There was a question in the chat box. Responsibility with the COVID, yeah, MOH, it is the MOH. Any questions? So again, the role of the MOH. So this is 50 marks. The earlier question, it was just 25 marks. So you can just write like this. Just, number and in a shortened form. And when it comes to the other question, it's 50 marks. So 50 marks, what you should do? You have to elaborate a bit. So what is the AEFI? What do you mean by an AEFI? And you can just describe not describe, there are 4 types, 5 types like that. And then say, you can prevent the AEFIs. There are preventable AEFIs, the program, immunization related AEFIs. So likewise, you just write it. And again, the same things that you have to tell. Screening. And make sure that there is proper record keeping. You have to coordinate with the hospitals, GPs to get the information. And then you have to report. As I said, if we have reported those AEFIs for rubella those days, that child would be alive today. And awareness and training, take corrective measures, monitoring and supervision. So role of the MOH ඕන ප්‍රශ්නයකට මේක අදාළයි. Monitoring and supervision කියන මේක ලියන්නම වෙනවා. Provide guidance and training and communicate with staff and community if there is a serious AEFI or there are cluster of AEFIs, and investigate. So 50 marks, I think you can do it. Any questions? ළමයි නිදිද නෑනේ?
In 2015, madam. Yeah.
Okay.
Yes, madam. In the chat box that in 2015 new paper, they asked about how to investigate the clustering of cases.
There is it's a separate big this thing. Shall I just go through that?
Okay, madam.
I did not get that question. Otherwise, I could have done it. There is, if there in the web, there is a book in our epidemiology, National Guidelines on Immunization Safety Surveillance. It is there. We will just go through that. Everything is there. Whatever I have told, just give me 1 minute. Investigation 43. Okay. Investigation of AEFI, right? Yeah. So what are to be investigated? There are things that need to be investigated. I hope you have some understanding. All deaths due to immunizations or suspected, all cases requiring hospitalization that occurs within 1 month, all medical events that are believed to be have been caused by an immunization and the people are concerned. So those are the things that need to be investigated. So this is a cluster of abscesses, I think. Yeah. So it is under all cases requiring hospitalization, injection, make it, injection site abscesses, lymphadenitis, osteomyelitis, persistent streaming, severe local reactions, toxic shock syndrome, like this. Toxic shock syndrome in මොකේද? What happens? When does toxic shock syndrome occur?
Contaminated syringe.
Huh?
Contaminated syringe. Multi-dose.
Yeah. Plus අර පැය 6කට වඩා
Multi-dose.
yes, when we keep the reconstituted vaccine for more than 6 hours, and if you use that, definitely you are going to, not definitely, you may get toxic shock. So just when you remember like that, it's easy to write. Okay. And steps, there are steps. Make maybe pettiya may box එක තියෙනවා, so I think you need to just to look at it. Confirm information in reported AEFI. So you have to confirm, like in the outbreak management, ensure that the patient is properly and timely treated. Planning and preparation for investigation. So again, as I said, planning and preparation. Visit to the site of immunization. Right? So this is afterwards. So you get the abscesses. So when you have like general list of things to be done, so you incorporate it to the abscess. So visit the site of immunization, investigate and collect data using AEFI about patient. So how many patients? So like this thing, about the event, about the suspected vaccines, about other people. So what do you think when you see like about 10 or 15 abscesses? What do you think? What more things that you should see apart from this? So it could be either, because this is a specific thing, no? This is an abscess. So either there is a problem. This is a programmatic error. What can the cause be like? What do you think?
Either improper technique or either contaminated vaccine.
Yes. What do you mean by improper technique?
One of the staff member may giving the vaccine in unsterile manner.
Yes. So now you are pinpointing. So that is good. So you have general things, then now you have to pinpoint to the abscesses. So make it about the suspected vaccine, about other people. So make it assess immunization service by conducting interviews, observing the service in action. So what do you think? You have to observe and see whether that if one person is doing it, so you can go back and see whether the immunization is done by just one person or 2 or 3 person. So this is in the MOH area, no? So you can see, you have to write whether this is through the just one clinic, 2 or 3 clinics. If it is 2 or 3 clinics, what can happen? This 15 abscesses in 2 or 3 clinics. What can happen? Maybe the same PHM is in the 2 or 3 all those clinics. So you need to write all that. It is very important, because when you have a specific this thing, otherwise they will ask a general question, no? If there are like multiple AEFIs, no, they have asked vaccination site abscess. So you have to write the general things and pinpoint it to the abscess and write. Maybe you can say, maybe the next time they can ask there were 3 anaphylaxis cases following MMR. Then you have to think of that. So anaphylaxis is not due to a person's or the program error. No. So anaphylaxis could be due to what? A vaccine reaction. So you need to check the vaccine vials and you need to check the actually the quality. So this is another different aspect altogether. Maybe you have to stop the administration of that vaccine and send it to be checked and all that. So likewise, you have to pinpoint the problem and write those answers. But as I said, you can get at least 50 or 40 marks just by writing the general things, but you will score the other marks using the practical aspects that you have undergone or seen throughout this period. Okay. A specimen collection and conclude investigation. I will send this to you all. Okay. Then
Okay,
you can because I actually, if I knew about this question, I would have like included it, but I will do that. So all these things, as I said, screening කියන එක කොහොමත් ලියන්න පුළුවන් නේ. Coordinate, report, awareness training, supervision, monitoring, guidance, communication, investigation, ඔය ටික ලියන්නම පුළුවන් ටිකක් නේ. Whatever. So we need to do that. I will send it. Okay, sorry. It's like a separate chapter. The box is there, so I will send the box. Okay. Okay, then discuss the importance of having a national surveillance system. Then I think you should now talk a bit. So a 50 mark question, what would you do? පටන් ගන්නේ කොහමද? Now this is actually an essay type. What can you write? Actually, what is the important? So we were talking about this actually. So you just need to put that into words and write it. Why are we having AEFI? Because we have a immunization program. So why are we monitoring the AEFI?
To upgrade the program.
Yeah, to protect, to upgrade, to maintain the quality, to actually motivate all that, because we need to keep the public disease free. Okay, so you start like that. Protect the individual and public from vaccine preventable diseases. And we know that modern vaccines are safe, but as with everything, there are other factors. So as with any other food, any other lifestyle, there are risks associated with vaccine. You need to write that as well, right? Otherwise, so we are aware of the risk, and some may experience, not all. So there are millions of vaccines administered, but not all will get AEFI. There are AEFIs. It could be mild or life-threatening, moderate, life-threatening. Majority are coincidental. Some can caused by the vaccine reaction, and maybe, as we said, by the immunization reactions process, and there may not be any relationship at all, right? So there are instances when we vaccinate a child and then they develop fever and maybe get hospitalized to see that he has got dengue or meningitis or some other fever. It is not due to the vaccine, but may be attributed to the, especially meningitis. So people will say that it is due to the vaccine. We have to investigate also, because we never know what happened. Dengue we know, but meningitis you are not too sure. And there are new vaccines always being added. So MMR, HPV, and all that was added to the program. How many vaccines are given now? EPI program? Mataga? Starting with the BCG. Can you remember? BCG, OPV, Penta, then
Vaccinated
MMR,
IPV.
FIP. Fractionated IPV.
Yes. So like there are now nearly 12 vaccines. So all the time it is getting added, and we never know whether we will be getting more vaccines like chicken pox. So at the moment, no, but we have to think of that. And there are emerging diseases like COVID. So we have to use new vaccines, and the post-marketing surveillance is one part. So you use that term as well, post-marketing surveillance. So post-marketing surveillance is that you are using as in any other drug, and we have to report. And increase in vaccine use, there will be an invariably there will be an increase in AEF. And it is the immunization safety profile that we are monitoring actually. So as we said, we are having 5 types of AEFIs. It could be due to the vaccine itself. So we have to know whether we are receiving a safe vaccine. So with the COVID vaccine, what happened? COVID coax first AstraZeneca. We all had the vaccination. Then because of surveillance, AEFI surveillance, what did they find out? In the AstraZeneca vaccine, they found out clotting issues are there, no? Oh, 100%. You know about that?
Yes, madam.
Yes. So because of the surveillance, so people know that they are sure. So do we stop vaccination at that point?
Yes.
No.
For
Because
few
we
days.
know, yeah, we are not stopping, but we are more aware, and we take precautions. And that is how the program goes on. And we safeguard because of the AEFI surveillance, we safeguard the credibility. So people can't say the people are dying because of the vaccination, because we know if they get clotting effects, then there are treatment options available. So the credibility is protected. And it allows for the proper management of AEFI, because as I said, you remember the HHE, we have never heard of it before 2008. Actually, we were there when it was introduced and we never knew of the HHE. And because of surveillance, we got to know that there is a problem like this, stopped the program and then restarted with precautions. Same, the MMR, rubella, there was deaths due to anaphylaxis. So found out what is the cause and then stopped the rubella vaccine and introduced MMR, and again introduced the management for anaphylaxis into the system. So this is why it is important. So there are so many factors affecting the vaccines other than AEFI. There are people who are talking all about those things. So the AEFI surveillance is one strong part where we can, have scientific data to show the results and avoids inappropriate responses to reports of AEFI. So people will say like 100 died due to COVID-19 vaccination. They tell like that, no? But if we have proper data, we can say, no, this is what happened. Okay, 4 died due to this and that, but not 100. If you have data, if you don't have data, if you don't have a surveillance system, you are just in the dark, and you have to take all those things into consideration. And there are more concerns on quality and safety, and people may refuse vaccines because of AEFI. It happened, and the school program stopped ATD. Even ATD was stopped, and there was a dip in this thing, and then there were measles outbreaks, and people will be susceptible to vaccine preventable disease. And when we see those dips, when we see the concerns, when we see the AEFI data, we can talk, we can promote vaccination using this data and to regain the public confidence. So all these things we can actually relate with the rubella program. So all these things happened during that death, 2 deaths in 2010. So we used the AEFI data to actually regain the public confidence. And when people know that there is a mechanism to look into their concern after vaccination, they actually are happy to have our service, and they have satisfaction and trust in the quality of services. Okay, so those things you have to write. Okay, no? Any other points that you want to highlight? මට අමතක වෙච්ච ඒවා තියෙන්න පුළුවන්. So point form you can write, try writing those things. Okay.
Okay, madam.
Oh, any other question that you want to start? AEFI, I think we have finished. අනිත් ඒවා මම සේරම ලෑස්ති කරා. නිදිමත එන්න කලින් මේ හොඳටම කරන්න ඕනේ ඒවා තියෙනවා. Any other thing? What about this?
We'll do that, madam.
Okay.
Okay, madam.
So, how many notifiable diseases are there? කීයක් තියෙනවද? මතක නැහැ. It is important to know that, because then you can write there are 26, maybe more now. Ek poda band 26 notifiable diseases, and any other කියලා එකකුත් එනවනේ. Disease that occur in large numbers. So when you have 50 marks, you need to just to write that. Okay. Can you tell what would you write? පොඩක් කියන්නකෝ. Anyone?
Diseases which has potential to cause epidemics and outbreaks.
Yes, yes. So again, as I said, you can, you know, use the same words again and again, but you can elaborate. So as she said, morbidity and mortality, the numbers, the data, so you can just write some examples like dengue, rabies, COVID, whatever. COVID nan tama notifiable naha. And preventability. So you don't actually, you can include any other disease to this thing, but why do you need to incorporate it? Because you can either, as someone said in the earlier question, what is the objective? Either you can control it or eliminate it or eradicate it. Okay. So the preventability, whether we have a vaccine, whether we have a treatment, whether we have a vector control method or any other thing, maybe we can provide safe water, something like that. And there are, if there is a preventable cause, and sometimes can affect vulnerable groups. It can affect the children or the pregnant female. So it is a concern, right? So we can like justify. So this is affecting vulnerables and we need to know because we have to protect them. And when there is a availability of a established surveillance system. So established surveillance system in the sense, where does the surveillance system start?
The notification.
Notification. So that means either from the GP or from the hospital, we need to get the notification. So if there is a disease that is not actually captured in a hospital, I mean, it will be okay in a other developed country, I don't know, but can we get the data if it is not like the people do not go to the hospital to get treatment for that disease? It is very difficult. Then what you have to do is we have to do a what?
Survey.
Community. Yeah, community survey, like those days, like in malaria, likewise, then we have to do. Otherwise, if we have a available system, we can incorporate. So in 2013, leprosy was introduced to the notification system. It was not in the notification system earlier. So who is treating leprosy and who is notifying leprosy? Who is treating leprosy?
Dermatologist.
Dermatologist. Okay, good. Now dermatologists, for the most of the time, they have informed the leprosy campaign those days, and the RE, not the MOH. But now they have to be trained to inform the MOH as well through the H544. So if there is an available established system, that's we can we have to take that. And teamwork. So it is like teamwork in the sense we have to. It is actually not teamwork, but communication. Yeah, teamwork. Because if people refuse to notify, then it is a problem. We can't do that. And resources. So if the leprosy is not notified because the, like, you know, the hospital people are saying we have more work, and because usually the clinic people in the clinics, they don't like, you know, use the H544. So we have to think of those as well. Again, when you say resources, what should come to your mind?
3M's and T.
3M's and T. Ekalianda, man, material, money, and yeah, because you need all that. Because when you add a resource disease to the notification system, it is not just a name in a paper. You have to have the actions behind it. So when the H544 goes to the MOH has to inform the PHI has to visit the place and initiate action. So man, material, so we have to check whether we have enough MMMT to do that. And sustainability, again, as I said, whether we can keep up the thing. Now, leishmaniasis was made a notifiable disease. So we have to keep up, and because sometimes we are not getting the notifications, but actually now it is improving. So likewise, all these words you can use with a little elaboration. Okay.
Excuse me, madam.
Any other thing that you can add?
Madam, regarding COVID, is it worth to incorporate into notification system?
No. Because actually, yeah, because is influenza included in the notifiable disease list?
No, madam,
No. So it is actually, you know, this is a sort of a human to human transmitted disease and seasonal, sometimes influenza. But COVID, it will be the same one day, and it is not worth, because we are, so all this is involved, no? What is the morbidity, mortality? Are we worried? When it is a pandemic, we are worried, but like preventability and affecting vulnerable groups, availability of an established surveillance system. So what is the actually the point where they can report? Is it the lab? So we have ILI surveillance, so we will get some sort of data, but it is not worth actually to include it in the notifiable disease register. So you may be asked that question. We don't know whether
Yes, madam.
so you can like argue both ways.
Yeah, to discuss, isn't it, madam?
Sorry.
They may ask to discuss.
Yes. Yeah. So maybe they will ask whether vaccination could be incorporated into the EPI system. So what you need to realize is, don't ever confine yourself to one side of this thing. You can always like have argument type answers. And again, as I said, this thing you can, you remember I was talking about the leptospirosis data. So there may be many reasons. So you can write all that. So they can ask whether it is whether it is feasible to incorporate the COVID vaccination to the EPI system likewise. So you can say, okay, like this, but it is the virus mutates, and because we are not including the influenza, because once a year the virus change, and this thing, the vaccine needs to be changed, and the sustainability, the cost of the vaccine and all that, and when there's a huge proportion of people to be vaccinated, whether our MMMT is enough. So everything you have to take into account, right? Okay.
Yes, madam.
Okay. Any other question? Are you okay with that?
Madam, what are the disadvantages of incorporating COVID vaccine into the notification system?
COVID vaccine or COVID disease?
COVID disease.
COVID disease. No, actually, just think, like again, as I said, the resources. So you get about with the routine work, right? With the routine work and with the other diseases, you get 10 dengue cases per week and 100 COVID-19 cases per week. Would you think our like what is the purpose of us getting into this, and like can we prevent at least now dengue we can do something, but when you have one case of COVID, do you think you can prevent 10 people getting COVID?
No.
The PHI has to go there. Okay, let's say the PHI has to go there. Then what will happen? He will say, okay, mask එක දාගෙන ඉන්න, අත්සෝදන්න, ඈත් වෙලා ඉන්න, something like that. Do you think that is effective?
No.
So by the time the PHI goes there, he would have infected 10 or 20 people. So it is not actually feasible. Once you vaccinate the whole population, and then if there are no deaths and no ICU admissions, it will be just another cough and cold. So you don't, I mean, it's very difficult to see that type of this thing. But chickenpox, you can do something. So because we see the disease, and earlier the person would have spread the disease, but there are some things that we can do, but not COVID. It is mainly the resource and the type of disease. So this has a RO, and there is a possibility of rapid transmission, So the PHI or the MOH can't keep up with that. Okay.
So we can argue on the morbidity and mortality rates, isn't it, madam?
Sorry.
With the morbidity rates and not the morbidity, mortality rates, we can argue. Yes.
Even the mortality, it is with the number of infections, mortality is very, very low. The rates
On the in COVID.
In COVID, yes.
Yes.
Because actually we are not testing properly in Sri Lanka, but even now the COVID-19 death rate is very, very low. Rate in the sense compared to the number of infections.
Yes.
Only thing that we are seeing the number of deaths are increasing because within given a short period of time, the deaths are increasing.
Right, madam. Right.
Yes.
Yes. Thank you.
Okay.
And madam, for the COVID-19 disease surveillance, only we had these newer technologies only, no, madam?
Technology?
Only we use the newer technologies, no, madam? Not any other specific. For the surveillance.
Notification.
Yes, madam.
Notification, actually it is not a notifiable disease at the moment. And it is notified through the labs, and when it is laboratory confirmed only, they are notified. Laboratory in the sense investigation wise. So not through any paper-based system. Paper-based in the sense individual paper-based makeup name. It is lab notifications. I think that's what you are asking.
Yes, madam. But sometimes within the MO setup, they have informed through over the phone and mailed it and like that, no, madam?
Yes, because if they have done any rat and
yes,
they become positive, they send in the Google sheet.
Yes, ma'am.
Or the mail. Yeah. Actually, it is not a proper surveillance system. It is very difficult to do a proper surveillance system in a pandemic, actually. So it would have been easy if we used some other method like tracking method other than the conventional surveillance system. Nowhere in the world that they use the normal surveillance method. Okay. So have you done the outbreak control?
Yes.
Okay. So you know the steps. Keep those in mind. Those 10 steps. I hope you are very thorough with that, because actually this is the cornerstone of what the PHI does. Okay. Just to outbreak manager, not the PHI duties in the as specified in the question. So whether it is a PHI or a doctor or whoever, the outbreak management, you prepare for the field work, establish the existence of an outbreak, verify the diagnosis, construct a working case definition, find cases systematically and record information, perform descriptive epidemiology, develop hypothesis, evaluate whatever. So you know that. So this is the question is, describe the activities which a public health inspector has to carry out during the field investigation of a notified communicable disease. Indicate how these activities will contribute to the control of the communicable disease at the community level. Okay. What do you think? The public health inspector, what does he have to do? Okay, he is notified of a case of dengue. What does he do first? Can somebody answer?
He will do a field visit, madam. And
Yeah. Before the field visit,
He will document the notification he get.
prepare for field work, right? So when you think of that, you think of those 10 steps, right? So he has to go to the field. Before going to the field, this is not happening now, but this is what should happen. Prepare for field work. How? How does he prepare? So when you write prepare for field work, that is not enough. It is enough to get you somehow this, but as a public health person, this is not enough. Prepare for field work. 50 marks. Prepare for field work. මොනවද කරන්න ඕනේ?
You need vehicles and logistic.
He has a vehicle. Maybe he has to check the fuel and all that. Okay. Good.
He has to document the notifications to visit
Yes.
the places in the relevant books.
Yes.
And,
Pocket note.
yes,
he has to prepare the field team.
and the registers. Then
He should inform the MOH and get administrative support.
Yes. So
And
this is
prepare-
just one case, right? So as good that you remembered the vehicle and all that, you can put it there, right? ඒ කියන්නේ මොනා හරි ඒකත් man material ඒ ටිකම දාන්න පුළුවන් නේ. You have to get the time and all that, and you have to think. Documents ready කරගන්න ඕනේ. So he has to take the H411. You remember those documents, no? What is H544? Notification form. So then the person checking your answer knows that you know those things. Like H544, H411. What is H411? Have you seen it?
Yes.
Two components, and one has to fill by the PHIU is investigating and send with the 544.
Yes. He has to take that to the field. H411. It is the huge paper. So it is the details of this thing. And actually, this I learned from our senior PHIs. According to the disease. Now, if he gets a diarrhea case, in those days they have to take some chlorine, it seems, because then only he knows, like if he thinks that the well is contaminated, then he can actually without going back, he can attend to it. And prophylaxis like doxy and those days rifampicin, health education material, he can take. So he has to prepare. What happens nowadays? Nobody prepares, just go. And this actually, those days, the senior PHIs used to do. So prepare for the field work. So you write that. It is, then people will know that you know. Visit the site. When you visit the site, what do you do? In the outbreak management, you verify the diagnosis. You check the records, diagnosis card and all that, and see whether. So you can actually, in this question, you can take one disease and elaborate on that. Check the records, whether it is dengue or viral fever, whatever. And if it is dengue, what should be done? So without verifying the diagnosis, you can't control the outbreak, because you don't know what the disease is. And verify risk factors according to this thing. So if it is a case of measles, you have to verify whether that child had measles vaccination, whether the people around had vaccination, and if it is leptospirosis, whether they had prophylaxis, and whether any other comorbidities are there. Likewise, you have to verify the risk factors. And you just, these are the activities usually the PHI do. Then you have to relate that to what? According to this question, to outbreak control, no? So when you verify all those, how do you control the outbreak? Then ensure whether the patient is taking treatment in diseases like leprosy or TB, and whether they have done the lab investigations, and if measles investigations has not been done, what you have to do? Have to collect blood and send it to the MRI. So those things need to be done. And then again, as I said, you have to write how this helps to prevent outbreaks. And then you should not stop at that house. You have to find other cases in the community. You have to visit at least 5 or 10 houses and see whether, and ask and check whether there are any other cases in the community. What else?
Health education.
Sorry?
Health education.
Health education. According to the disease, you can take many actions. So you can like advise if there are any people who needs vaccination, prophylaxis, treatment, health education, maybe vector management, sanitary measures, safe water. So all that can be done. So you can write that as well. And actually, health education is very important in any notifiable disease. So this is, as I said, you can always use those words. And then record the findings in the pocket notebook H411 and communicate the findings to the MOH. So you see, so all these are done to manage the outbreak. So when you know about the outbreak manager, it's very easy to write the answer. මෙන්න මේ 10 කටපාඩම් කරගන්න කියලා කිව්වනේ. Who did outbreak management?
Deepa madam.
Deepa madam.
Sorry?
Deepa madam.
Then she would have told you, no?
Yes, madam.
You have to actually by heart the, you know, the 10 steps. 10 1, 2, 3, 4, 5, 6, 9, 10. Yeah, but usually 10 steps වගේ කියලා තමයි කියන්නේ. So all these steps you have to keep in mind. Okay? දැන් කටපාඩම්ද? When is the exam?
5th of May.
5th of May. You can do that. මේකේ පොඩි මේකක් හදාගෙන මේ what Dr. Deepa said, those steps පොඩි මේකක් හදලා කටපාඩම් කරගන්න. You can fill the other stuff later, like when you write the questions, but you like, you know, by heart those 10 steps. It will come in very handy. Okay? Did I forget something? Do you have anything to add? PHI karne? No? Okay.
No, madam.
What other questions we need to do? Herd immunity. ඊළඟ එක මොකක්ද? This or the herd immunity. This is also very important. You may get something like this. What do you think? Herd immunity is very important as well. What do you think? මොකද කරන්න ඕනේ?
This one would be better. Important, madam. The last one, the describing the key factors contributing to the
last one කියන්නේ මොකද්ද?
The re-emerging of
80 marks.
describe the 80 marks one. Describe the key factors contributing to the appearance of emergent re-emergent.
Okay. Again, මේකත් හරිම ලේසි ලියන්න. Right? ඒවා බලා ගන්න මේවා emerging, re-emerging. Okay. මේවා ටික තියෙනවා. මේ විදිහට මතක තියාගන්න. What do you know about the epidemiological triad?
Agent, host, environment.
Agent, host, environment. ඔය ටිකම තමයි මේ වගේ තියෙන්නේ. There are viral or the biologic agent factors, human factors and ecological factors. So මෙහෙමම ලියන්න viral or the biological factors, human factors and ecological factors. Then you elaborate. Human factors කියලා ගත්තාම, so those are the things. What happens? People, there is overpopulation and changing of demographics and all that, and distribution. So people move to other parts of the world, and there are then new diseases to those communities, as we do now do for measles and leprosy, because the Western world think that they have eradicated leprosy, but the people from the tropics go there and they don't know that we are taking leprosy to them. So in Italy, they can't recognize leprosy because they have not seen a leprosy case among their population for a long time. So they have forgotten, likewise measles. So because of that migration, those population factors play a role, and the behavior change. So sexual practices change, you know, what happened with HIV/AIDS in the 80s. There was a lot of liberated thinking in US and other Western countries, and the homosexual activities and all that. So it is actually because of those actions, people change. That is it. So then again, the organisms also they find it easy to migrate to other populations, and increase need for child care outside of the home, because those days people were like, they were mostly at home, but now the children are kept in other places, and there are like diseases, new diseases coming up. There are lists in the other part. So the human behavior has changed a lot. Alcohol and drug abuse, food distribution and transportation, because actually now for the past few years people eating from home, it has changed to outside and delivery services and all that. So all of those will give rise to new infections or re-emerging infections. And immunization practices as well, because sometimes the Western countries now, they are refusing immunization. There is vaccine hesitancy. So all these things can, give rise to new and re-emerging diseases. And when forgetting human factors, again the human will tamper with the environment, land use change, and global warming, deforestation, and land development, natural disasters will give rise to those. Do you know how Ebola evolved? How did Ebola come into play?
No, madam, not much.
Huh?
Not much about that, madam.
I can't hear, sorry.
No, madam, we don't.
No, madam, no idea.
Yeah, actually, this is, people in Africa, in some areas, they eat the monkey, they kill the baboons or monkeys and eat their brains. There is a ritual. So through that, the Ebola virus has jumped into the man. So there are eating practices and deforestation, because when people get more into the jungle, and they had interact with the jungle, so those viruses come to the population. And HIV AIDS also, they say that the AIDS virus was there. HIV virus was there in the African population from the green monkey, and it was there, but there was no movement. But when it jumped to the Western countries, it actually it was almost a pandemic at that time. And chronic manifestations are there. And enhanced pathogen detection. So those days, we may not have had the the method to detect. So now we have the PCR, DNA, and all that. So we now detect. So how do you detect leprosy? How do you diagnose leprosy?
From the slit skin smear?
No, actually it's mostly clinical. If there is a skin patch and you get the hypopigmented, hyposensitive skin patch, you say it's leprosy. If you do a slit skin smear and you find this thing, okay. Most of the time you won't find. Or you do the biopsy, you won't find. But if you have a sort of a blood test where you detect without, and even without any patch, you can diagnose leprosy. And how many leprosy patients are diagnosed in Sri Lanka each year? අර මේකේ ගහලා තියෙනවා. Eye hospital, there is a huge board. Have you seen? Around 2,000 new cases per year. It can jump to about 6,000 per year if we have new technology. New, or I don't know whether it is available even in other countries. It's not. But if you have like a sort of a PCR or whatever, you will diagnose. So this is what happened in COVID. This is what happened in dengue. So you get the dengue NS1 and all the people are admitted to the hospital saying they are having dengue. But those days they had dengue, 3 days they are okay, they are home. We don't know whether it is dengue or not. So that question is there in 2012. Dengue. So you can write that also. There are diagnostic methods that can increase the number of cases. And microbial evolution. So that's a genetic, the mutations, and they will adapt to the environment. And so you see what happened to COVID. And the breakdown of public health system. This is very important. Decrease funding. And in USA, they don't have a public health infrastructure. Population mobility, international travel, immigration, bioterrorism. So people are saying even COVID is bioterrorism. Do you know the eradicated disease smallpox? Where are the are there any smallpox viruses now in the world?
In the laboratory?
The labs.
In the laboratory. There are 2 laboratories. So one in Russia, one in America. So with the wars, maybe they are unleashing those things. We don't know. And even America, they are the ones who are doing most of those stuff. So those things are there. So as I said, you take the 3 things. Microbial factors කියලා viral කියලා දාන ගොඩක් ඒවා viral නේ. Human factors and ecological factors. ඔය තුන expand කරන්න. Okay? Human factors වලට මෙහෙම දාගෙන යන මේවා තියෙන්නේ. Ecological factors, deforestation, El Nino, floods, global warming. Human factors, population, migration, immigration, wars, bioterrorism, ඒවා ටික දාන්න පුළුවන්. Viral factors වලට new technology, mutations, likewise chronic disease entities. ඒ වගේ. Okay? ඔය ටික තමයි. We herd immunity. What is the time now? Are you all sleepy?
No, madam, it's okay.
Herd immunity. ඒක චුට්ටක් බලන්න. I think you all are okay. Most probably Dr. Deepa would have done it, no? මේකේ threshold. The threshold value should be there. මේකේ මම දාලා තියෙනවා threshold values. And herd immunity එන්න පුළුවන් reservoir human නම් තමයි. Do you think that we can have herd immunity for JE? JE, can you have herd immunity? Measles, can you have herd immunity?
Yes, ma'am.
Yes.
Yes. JE?
No. Other animals, zoonotic disease.
Yes, because the mosquito can come and bite the susceptible person. Like this is the herd immunity, no? Measles, this is okay. But when a mosquito with JE infection comes and bite this person, he will get the disease. So even if the others are protected, because the reservoir is there, so you have to do that, know that. And there is a threshold level. Measles, it is around 95%. polio, 80% of the population should be immune, either from the disease or from the vaccination. What is the safe way? From the
Vaccination.
disease or the
Vaccination is a safe.
vaccination, because you can't experiment. England experimented, ne? They wanted to have herd immunity, and many people died due to COVID. See, dangerous, right? You have to maintain an immunity level, and we have to protect. We have to protect the people who cannot take vaccination. There are people who have, like, they don't do the proper seroconversion. Even if they are vaccinated, they don't get protected. And there are like people who are immune compromised, newborn babies and other elderly people. So those people need to be protected through the herd immunization. And මේක තියෙනවා මේ රුබෙල්ලා වල 83 to 86% විතර population එකක් maintain වෙන්න ඕන to have the herd immunity. But the other 20%, every year they are going to get accumulated, the numbers. So outbreaks will occur every 10 or 15 years. So you need to maintain the immunity levels, thresholds. Okay.
Madam, COVID also, COVID also threshold level 50 to 80?
No, it's about 50 or 30 wage. I saw it somewhere. It's about 50 to 60.
Thank you.
Yeah, I think it's about 50 to 60.
And whether we have to tell about the R naught and RE in the three, while we talking about the threshold
Yeah,
level?
R naught. It's estimated R naught. See, 12.18, 12 to 18. You don't need to talk about R naught.
And if the R naught and RE difference is less than 1, RE divided by the R naught is it less than 1? Then we are taking as a herd immunity like that one.
I am not too sure about that. Sorry. You are asking whether we are taking as herd immunity.
Yes, madam.
I have not seen anything in the literature like that. I will check on that.
Okay. Somewhere in our lecture notes they have mentioned.
Maybe. Actually, I have not seen anything. So it is just R naught and the level, immunity levels. So
Madam, when we
yeah.
are getting the frequent mutations, can we talk about the herd immunity?
That's a problem. Yes. That's why actually even in influenza, 33 to 44%. So, I mean, that means that this is I think this is a earlier document. It's very difficult to talk about because then you have to treat as a new disease, basically. Now you see Delta, then Omicron started to, I mean, it was actually a milder version, but then again you have to treat as a new disease when the mutations occur rapidly. So herd immunity, actually what we see, the symptomatic patients only what we are seeing, but there are many who will not be symptomatic. So we can't say it's just 33% for influenza. It may be more even for COVID. it could be 80%. Because we know we are not testing, we know that a person will infect at least 2 or 3 others. So it could be at least, this is depending on the testing capacity that we are talking. But actually it is more. And actually speaking, respiratory infections, it is very difficult to talk about herd immunity. So even with vaccination, it is difficult to control. You know, like influenza, for COVID infections, it is very, very difficult. Okay. Others, I think, what about the other? This is, I think I have just reasons for low vaccination coverage. So you know how to write that, no? 50 marks. So the ATD we are giving for the school children. So how many children attend the school? So just, we don't need statistics, but there's a fraction who does not attend school. Again, you have to think of our resources. And again, I think when was this question given? Most probably due to during the rubella death.
2012.
Huh?
This 2012.
Yeah, most probably. So it was during that time, 2010, and ATD coverage actually dropped. So you add the AEFI, serious AEFI. So all this can contribute. So you elaborate on that. There are dropouts, non-attenders. So you see all these questions come from current topics. So current topic at the time, it was because people, even though they stopped rubella vaccine, the ATD was given, so people did not come to take ATD. But you just can't say it is because of that, but there are so many reasons. Lack of awareness and the support from schools may be low, and our resources are less, and injection reaction, the people faint and all that, the elder the children, there is a fear, non-attendance. So all that is there. So you have to write all that. Don't don't just stick to one or two. Write all the reasons that you can think of. මේවන ඉතින් කටපාඩන්නේ. This food safety and hygiene. Actually, I am also not very this subject, whatever the field experience I have, this is, you have to check on all that. I just took from whatever we talk to the PHIs. Were you all given any notes on this? Somebody did the food establishment, the food unit or nutrition unit?
Yes, madam. Anand said it previously at the start.
Do you have his notes?
Yes, madam.
Can you check with that, because I'm not too sure, because this is what we do on in the field. I'm not too sure about the theory part. That's the problem. Is it okay?
Okay, madam. Okay, we all have the let's note, madam.
Yeah. Just check on this and see whether it is okay. Because there are some aspects, again, what you have to think of the general aspects. Like you like divide the answer like that, general. So what is general? Food establishment needs to be registered, no? Whatever food factory or food establishment needs to be registered, whether the registration is there, right? Likewise, and then whether it is maintained. And again, those things are there. Maintain sanitary wise and other wise. And then the production of food. So whether they are using the correct thing, safe, quality, everything, you need to check. And personal hygiene, water, and all the others you have to check. I was not too sure about this question, but I think you can write this and find out whether it is compatible with your lecture notes. Okay?
Okay, madam.
Right. Again, this is important, the dengue questions. As I said, there are like questions like discuss possible reasons for this situation. So possible reasons. What are the reasons? Again, you can write the triad: vector dynamics, environmental factors, viral factors. So what are the vector dynamics? Why did the increase happen? The number of dengue cases due to the vector. Maybe the vector, there was increased vector density. We don't know. In 2012, there would have been conducing environment. In my case, I know personally in 2012, there were power cuts. And in our area, in the district where I worked, actually, because of the power cut, there was an area where they used the tube wells, and the tube wells were connected to a motor, and they took the water from that. But due to the power cuts, they can't take water. So what they did, they used the hand pump, and once the electricity comes, they did not use the hand pump. So at that time, it was a very dry season, and no rain, nothing, but a huge outbreak. 10 people died in that small area. We could not find the breeding sites. Ultimately, we found that because there are no water anywhere, the vector is, the mosquito is laying eggs in the inside the tube well, there is a small amount of water left after the pumping by manually, and in that small water, this thing, they lay the eggs, and then because actually they have to lay their eggs no somewhere, so they have to find the water, and because of dry season no water, they found it, and even though they know that within 3 days this is being used again, they lay the egg. There was a huge outbreak. Only later we found. So like that, there could be vector dynamics. And what are the environmental factors which could have increased the number of dengue cases? This year also number is increasing. So you may get a question like this. What are the environmental factors?
Monsoon.
Yeah, rains, floods. So you can say it could happen. What are the viral factors?
Viral is more serotypes.
Yeah, serotypes. At that time in 2012, I think the type 2 was predominant. So there are, and maybe, as I said, laboratory investigation change could be there. So if there are improved technology, you can. Then population dynamics, mobility, increased mobility of the people. So you can write all that if you divide like this, okay? And situation. Then as the medical officer, how would you plan and implement an effective dengue control program? Have you all been taught how to write a program?
Yes, madam.
So you write according to that. When you write, this is specific for dengue, no? So the situational analysis, you write accordingly. Review data about the dengue disease, vector. So vector is like Brito index, container index, household index. So you insert those things into the answer. Then the spot map and the resources. You use the spot map for prioritization of what?
Resource allocation.
Sorry? Prioritization of?
Resource allocation and preventive.
Yes. Resource allocation plus area. Identification of the areas. Because we don't need to do the whole MOH or the whole district, but we can use. So when you say prioritization, not just prioritization of the resource allocation and the area to be selected, and the resources, whether we have enough people, whether we have enough vehicles and all that, and whether we have enough insecticides, pesticides, and other, plus funding, and the period when we are going to do, and then plan the program, how we have to advocate the leaders, political leaders, and the other leaders, maybe our administrative officers, we don't know. We have to aware before we do that. We have to, when we are planning, we have to aware, and there we have to have the intersectoral advocacy, awareness, intersectoral collaboration. So in dengue, those people are very essential: local government, AGA, police forces, CBOs, whatever. So those people, and schools, intersectoral collaboration is very, very important. And funding, resource allocation. So as a MOH, how you do that? So if you have one vehicle, then how to get other vehicles, likewise you have to plan. And implementation, supervision, So you need to say what are you supervising, monitoring, and then reporting, evaluation. So you can elaborate on that. Did I miss something here?
No, madam.
Everything is there, no?
Yes, madam.
Yeah. So you write according to the disease. It could be COVID, it could be dengue, the same format, okay? You just need to highlight whatever the disease that you're doing. 2.3, I'm sorry, outline the new interventions which may facilitate dengue control in Sri Lanka. Now, this is very important in the sense, in 2012 or 14 or whatever, they would have planned to introduce මොකද්ද හුචරේරියාද කවුද? අලුත් මදුරුවා මොකද්ද? වෝල්බැකියා. වෝල්බැකියා, dengue dungs, දර තියෙන්නේ dungs, BTI. They would have had plans. ඉතින් ඒක ඒ කාලේ හැටියට තමයි ලියන්න ඕන. Genetic modification, I don't. So I don't think they will last now unless they have other this thing වෝල්බැකියා hari මොනවා hari එකක්. But as I said, you need to keep up with the new trends. මේ දවස්වල මොනවද වෙන්නේ කියන එක. ඔය මේ දීපු notes වල අන්තිමට ඇති we are doing this and that for all the things. As I said, leptospirosis වල now we are trying to see whether we can incorporate PCR into the investigation. Likewise, people will say, so you need to check on that, whatever they have said. Those are the new things that are being planned. මට ඇත්තටම ඒක නම් I can't remember what they have planned at that time. Wolbachia, BTI, dungs, I don't know. There may be so many things. But again, keep dengue as a priority question because dengue is increasing and COVID will also come. What else? Any other questions you want to ask? Is it okay? Any questions you want to?
Madam, please, can we have your presentation, PowerPoint
Of course,
presentation?
of course, I will send.
Okay.
Is it okay?
Thank you,
No,
madam.
like actually I have not, I just quickly put it together. Is
No,
it
madam,
okay?
that's fine. Yeah, madam, that's fine, madam.
Okay, I will send it and I promise that I will send the AEFI thing also, no?
All right,
AEFI investigation box.
Yes, madam.
I will put that into the presentation itself and send, okay?
All right, okay, madam.
Are you okay? Is it all right?
Yes, madam.
Yes, madam.
Yes, sir.
Thank you very much, madam.
Okay,
Thank
okay,
you.
then.
Thank you.
So much.
Okay. Any question you can email or call, whatever. Anyway, send a message. I will do my utmost to help you. Okay.
Thank
Best
you
of
very much,
luck.
madam. Thank you,
Best of
madam.
luck. Hope you all get through. I hope that otherwise our public health, we need people like you. Right. Then see you. Okay.
Thank you.
Thank you, madam.
Thanks.
madam.
Good night.
Madam. Good night. Thank you, madam.
Okay.